Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. It's for that reason that STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By providing this important education, hopefully more people will feel comfortable discussing their own mental health challenges and get treatment if necessary. Now, in this installment, we'll be discussing eye movement desensitization and reprocessing therapy, or EMDR therapy. The effects of trauma vary among individuals, manifesting in diverse ways and significantly impacting survivors. Trauma-informed therapy can help address a wide range of mental health conditions where trauma plays a significant role in symptom development. Among the various methods of trauma-informed therapy is EMDR therapy, a specialized psychotherapeutic approach designed to help individuals reprocess and resolve disturbing memories and experiences that affect mental health. Unlike traditional talk therapy, EMDR does not focus primarily on discussing the trauma. In fact, it aims to change the way traumatic memories are stored in the brain, allowing one to heal emotionally without being overwhelmed by the intensity of their memories. So how exactly does EMDR therapy work, and how does it help those dealing with trauma? Well, today we're joined by Leticia Sosa, a licensed clinical social worker and the director of outpatient services at STHS Behavioral, to give us all of those answers. Thank you so much, Letty, for joining us today.
Thank you, Tom, for having me.
Now, obviously, we talk a lot about the impact of trauma, and there are reports that say about 70% of adults experience at least one traumatic event in their lifetime. That is a lot of people who will have trauma in their life, and of those, 20% will get PTSD from that. It's pretty alarming to see. Do you see that PTSD happening in the patients that you see from that trauma that maybe wasn't taken care of, handled at the beginning?
Yes, of course. So without proper treatment at early stages, trauma can definitely lead to PTSD, acute PTSD, and chronic anxiety, disease, even substance use and physical health. So it can even affect our immune system, and we can even have health problems as well. Definitely unresolved trauma, our body keeps the score, so it's stuck in our nervous system and results in post-traumatic stress.
And now you work in the hospital setting, and unfortunately, these individuals are probably in the worst stages of their mental health condition. They may be in crisis mode, and things of that nature. And do you see that there's that history of trauma that may be impacting them, and untreated is leading to this hospitalization?
That is correct, and most of our patients have unresolved trauma, which unfortunately are now in our facility, and it has led to chronic disease, anxiety, even substance use as well. So yeah, definitely it's seen, and it's growing, but now most of these patients are getting care.
Now, we hear a lot about trauma-informed care, and that basically means that you're kind of paying attention to a patient, not with what they're dealing with right now when they come to you, but you're looking back at their history, you're seeing what kind of issues may have come up, there may have been a trauma in their life, and so as you treat them, you're looking at their whole history from the beginning to where they are today. How important is it to take a look at that whole picture?
Yes, of course. So we go back to their past. I truly believe that their past definitely comes out now in their present. What has happened to them in their past? How have they coped? Where are those memories stored? And how they react now definitely affects their mental health, and certainly different uses like in substance use or addictions as well.
Now, when it comes to EMDR therapy, so we always hear about talk therapy, that you're going to go and you're going to sit with a counselor, you're going to have a conversation, and you're rehashing this history and these memories and these experiences that you've gone through, which can obviously resurface the trauma that you went through. So EMDR, how does that change the narrative?
So EMDR is completely different from talk therapy. You are correct. With EMDR, we do go into certain events, certain memories that have been stored in the memory but have not been processed yet, but unfortunately do surface up and are triggered by either one of our five senses, or certain things, certain life events might trigger that, causing us to have a distress emotion. And sometimes we don't know, well, why do I react this certain way? So this is where EMDR comes about, and we'll talk a little bit more on how it works. Yes.
Now, it was developed like back in about the 80s, from what I read, when it comes to EMDR therapy. But what I understand is that it has evolved greatly. Is that right?
Yes, that is correct. So it evolved. EMDR came about. It was discovered by a psychologist back in 1980 by Robin Shapiro. It's the famous walk in the park. And she was not having a good day. She started walking, and as she started walking, she was processing certain incidents that had upset her. And she noticed that when she returned, she wasn't as upset. The emotion had definitely decreased. So as a psychologist, she dived into it a little bit more and kind of went back and said, well, I was looking at the trees, and she forced herself to actually do the eye movements. And as she recalled those certain events, it actually the emotion was less.
Oh, wow.
So yeah, that's how she developed EMDR.
What inspired you to get into EMDR therapy and study it and be certified in it?
Well, in the Valley, there's not a lot of therapists that offer EMDR. It's backed by neuroscience. It's one of the newest evidence-based research traumas that have been out in the field, and it's definitely something that I can offer my patients in an acute setting and in an outpatient setting as well.
Mm-hmm. And you've had about 15 patients who have come through that you've been able to work with. What has the response been to the EMDR therapy?
It's been very positive and shocking as well, very cultural shocking, because they don't believe, right? Well, how can something as a bilateral stimulation help me reprocess my traumas or get those memories resolved and the feeling attached to it? So I've had great results. I've got feedback where what happened, what was that about, where the emotional distress was feeling a level 10, and after completely processing that memory, it's eliminated. That emotion is completely eliminated, and it's very heartening and rewarding to see how our patients have reacted to this, have responded.
Now you have a great presentation for us, so let's go ahead and get started.
Yes. So EMDR definitely stands for eye movement, desensitization, and reprocessing. It's a very important tool in trauma recovery, and it's based in the adaptive information processing theory. When I talk about it, I like to say, well, think of your brain kind of like a filing cabinet where trauma locks some of the files away, but it makes them hard to process. And EMDR, what it does, it helps reopen and reorganize those files. So the idea is that trauma and trauma experiences can produce certain memories that are very distressing for the individual. And at the time that the trauma occurs, the individual did not fully process that particular memory that was associated with the trauma. Hence, it causes difficulty in the future. So that's where I come in, where our past is our present. It comes out now. And as this individual grows up and as the individual goes about life, they have certain negative beliefs and thoughts and physical sensations that are associated with the trauma. So this is where the individual will get triggered. So if they see something, if they hear something, if you smell something, you think about a certain event that might have happened in your life, and that might be triggering for you. Now, certain events in life that happened or even other memories may come up until those memories are adequately fully processed. So a person cannot function at their best if they haven't processed that memory. And EMDR is all about resolving those problematic memories and processing them fully and having the patient function at its best. So how does it work, right? Well, it focuses on 3 different components that are related to somebody struggling with PTSD or acute trauma. For example, number 1, it would be past memories, where the trauma first occurred and how the person was dealing with that trauma at first. Secondly, is our present, how the individual is currently dealing with the present distress that unprocessed trauma is causing. And that could look something like difficulty in relationships, difficulty in processing your emotions, and how to handle any type of situations and how to cope with them as well. And lastly is developing a piece that's more of a positive coping strategy and belief for the future. Now, usually it takes about approximately 12 to 16 sessions for the patient to fully process a trauma, and there's different phases that we go to. It's actually 8 phases of EMDR therapy treatment that I would like to go ahead and discuss. So the first phase is the history and treatment planning, which is very similar to when you go to any type of therapist. You do a biopsychosocial, and it's the same thing. So it's understanding the person's history, what are their concerns, and obtaining that background information. And that's where we identify if EMDR is a suitable treatment for them. Now, we'll review the selection criteria, we'll have certain questionnaires and diagnostic psychometrics, and I'll educate the patient on what is EMDR. Once we find the groundwork and triggers and future needs, and the patient is a candidate for EMDR, we move on to phase 2. So phase 2 is preparation, or as we call resourcing. And here's where we teach the patient or the client certain coping skills. Now, if you've had sometimes many years of therapy, you'll learn a lot of different coping skills, mindfulness, with different types of techniques, with cognitive behavioral therapy, with dialectic behavioral therapy. And if you don't have any coping skills, this is where we assist you and help you identify some of them and what works for you. So we'll provide you with different coping skills. And once we kind of measure your window of tolerance, see where your distressing levels are, we move into phase number 3. Which is the assessment. Here, the purpose is to access the target for EMDR. Once we identify that target, we'll go back to something that we call touchstone memory. And here's where is the earliest memory you have of either having anxiety or having certain beliefs. And we identify a negative belief that is attached to that particular target, and we try to convert something into more of a desired positive belief. So we assess for current emotion, physical sensation, and we identify certain baseline measures. Upon assessment, we'll move on to phase number 4, which is the desensitization. And here is where we'll utilize the actual bilateral stimulation to help reduce the emotional intensity of that memory. Now, there's a certain procedure and certain protocols in incorporating eye movements. So we can, back in 1980s, they started just with the hand movements, which was just the bilateral stimulation, the movement of the eyes. Now you can do taps, or we can also stimulate the bilateral stimulation with auditory and tactile stimulation. So we have what we call TheraTappers and EMDR, and headphones where your stimulation will be, they take turns in the right ear, left ear, certain sounds. Upon completion of the desensitization, we go into installation, and that is where we increase connections, more of positive cognitive networks. So we enhance the validity of the desired positive belief. If previously the belief was, for example, I am not enough, okay, so how true is this to you now? How true is now the positive belief is I am enough, I do belong, and at this point we just kind of install it in our body and we tap that in. Upon knowing that that positive belief is installed, we go through a body scan. So we complete processing of any residual disturbance associated with the target, and if anything is left or you still have some distressing emotions, we continue to process that until everything is completely eliminated. And then we'll move on to closure. So we always ensure that our client's stability at the completion of an EMDR session and between sessions. So we do use guided imagery or self-controlling techniques if it's needed. And we check in with our patients on a weekly just to make sure that the patient is emotionally regulated and no other new traumas or negative beliefs have come about. And lastly, our eighth is the reevaluation. So we make sure and we measure the evaluation of the treatment effects, evaluation of integration within our larger social system. How is the patient doing, and how are they functioning now as compared to previously than how they were functioning? And those are pretty much the 8 sessions, the 8 phases, that EMDR goes through. And it takes some time. It doesn't immediately go from one day to the next, but especially on the installation, which is the second phase, the preparation, making sure that the patient is ready for EMDR. Usually that takes about 2 to 3 sessions. That's why I say it's about 12 sessions, because just the preparation in itself, it takes a while. But once we're already in the installation phase and we start processing, the patient immediately notices some effects. Now, the application for EMDR therapy, it's not only restricted to people with PTSD. It is very common for to be used with PTSD, but it's currently expanding to other conditions such as eating disorders, substance use, generalized anxiety, acute stress disorder, and comorbid disorders to PTSD as well. So, for example, also for people that have any minor life events and it's just a small memory, that can be assessed as well and processed. It doesn't have to be something that we go way back into childhood. And these are some other conditions, so psychosis, bipolar, chronic back pain. So pains are also one of the major conditions that we use EMDR for. And of course, just like you mentioned, what's the comparison between EMDR and like a trauma-focused cognitive behavioral therapy? Well, for EMDR, the client does not need to describe the trauma. It is very minimal. We go back to a memory, we go back to visualization. There's fewer periods of intense exposure, and there's no direct challenges or beliefs. There's no homework, there's no journaling assignments or anything where you can kind of request the patient to keep on monitoring their emotions. And there's a dual attention task. Now for trauma-focused, well, there's a little bit more to verbalize the experience. It's kind of like reliving it when you talk about it. There's longer periods of that intense exposure, and most of the time with CBTs, there's homework and exposure with cognitive interventions.
That all sounds so interesting, and I'm sure that especially as it's evolving and you're using more mechanisms, because I remember seeing like it was just the fingers at one point where you were sort of following fingers, but now as you see behind you, you have the light,
yes,
you have the headphones. What are these here?
So these are TheraTappers, and this is for, it's as well for tactile stimulation. So you'll put, the patient will have both of them, and you can add them with the headphones, and you can even do with the light. And this is how we can process, we can do EMDR as well.
All right, we'll get to all of that good stuff in a second, but let's ask a few questions. So obviously, first of all, let's talk a little bit about trauma. And we talked about this, the percentage that 70% of Americans will experience at least one trauma in their lifetime. Now, women are more likely to experience trauma than men. So they have a prevalence, a lifetime prevalence of about 75% compared to 65% of men. But men are more likely to experience PTSD, which I found interesting. Their prevalence is higher than women when it comes to PTSD, and that's probably because men don't necessarily seek the treatment as soon as maybe women do. Is that what you think that might be a reason?
So yes, they delay treatment in that, but I've seen now, especially for our outpatient services in South Texas Behavioral, the majority of my patients are now male. So and I believe the stigma is reducing, and it's being addressed a little more. But yes, I truly believe it's something that takes a while for men to actually come and look for therapeutic services.
Mm-hmm. And now when it comes to trauma, you mentioned obviously it has a significant impact on your physical health, your mental health, and your social well-being. And let's talk a little bit about, because there may be people who may have experienced a trauma and they're like, you know what, I didn't realize that I'm still dealing with that trauma. So some of the things that you may notice, obviously trauma affects people in so many different ways. There's not one, it's like a snowflake. They're not all the same. So you're not always gonna have the exact same symptoms, but you'll see if you're experiencing some form of trauma, you may experience some cognitive changes, right? So those intrusive thoughts, nightmares, flashbacks. Is that kind of a common one you see?
Yes, of course, an isolation, right? Or even excessively working long hours, right? We tend to not deal with our stress or our trauma, so we tend to kind of shift that focus and just work, right? Because we're trying to do like those avoidance behaviors as well. Mm-hmm. So, and definitely, of course, anger outbursts, that irritability.
So those altered behavioral patterns that you're talking about. There's also avoiding people and places. So if you find yourself like, I don't want to go near that place, you may be dealing with some residual trauma that you haven't necessarily tackled.
Yes, of course. So finding out what's the underlying cause, right? What can we do to help you and look for that support. Mm-hmm.
Psychological concerns, so that would be anxiety, panic attacks that may experience. So those psychological, and then obviously physical problems. So difficulty falling asleep, staying asleep, hypervigilance, which I believe would be a telltale sign that you're dealing with something. If you're always on alert and looking everywhere you go, that could be a sign that you may be dealing with some unresolved trauma.
Correct, yes.
Now let's talk a little bit about the benefits of EMDR therapy. So obviously you get to resolve that trauma, right? So you get to handle it, hopefully get through that, right?
Yes. So some of the benefits for EMDR, of course, it's reducing that emotional distress. So when you think about that memory, when you think about that incident, you don't see that heightened level of emotion, that heightened level of anxiety, distress, sadness. Even when you talk about it and sometimes you cry or you get angry, you're not able to talk about it and emotionally regulate it. And it also helps with rewiring the brain. So that's something that's very interesting because the emotional part of the brain does not know about present time like the cognitive brain does. So what happens when you're triggered? Well, since they're not connected, your emotional part may be saying, you're in that fight flight response while the cognitive is like, hey, we're safe, we're good. But now that you have processed that, you're with EMDR, you activate those two sides and you're able to now desensitize that emotion that's linked to that event. So of course it improves emotional regulation and it decreases the symptoms of PTSD.
And you also have improved relationships. So if you're able to deal with your trauma, you can live a healthier life with the people around you.
Yes, and any challenges that life brings now in the future as well, because now you'll have like those cognitive beliefs, those positive beliefs that that are now resolved from the previous negative ones that you had.
Especially because I feel like the improved relationships is so important, because sometimes we bring our history into a new relationship, and so we expect someone may treat us the way that we were treated in the past, or we may have suffered an unfortunate incident with someone from our past that now we bring in and don't necessarily trust the person in our future.
Yes, that's correct. Again, our past comes out in our present, so even if we have different attachment styles, we're able to resolve those as well with the EMDR.
Better physical health. So that means you're getting out more in the community, you're not isolating yourself, you're actually being active, you're out in the community and things like that. So it helps our overall health. You're not dealing with the stress, the panic attacks that obviously up your heart rate, things like that.
Yeah, the paranoia of, well, what if something happens to me here at the grocery store? Definitely all of those will be resolved.
Improve focus on concentration, focus and concentration. So I think that's really great. Like you really can now focus, you can concentrate without sort of backsliding into those memories.
Correct. And now that you recall, it'll be less intrusive, you'll be emotionally regulated, and you won't be having those panic attacks or that anxiety.
Better parenting skills. So it helps you become a better parent. Dealing with your trauma, handling it, will help you be a better mom or dad.
100%. You'll be able to communicate much more, and you'll be able to handle that stress that as parents we have every single day. And more than anything, we'll be able to reflect that with the communication with our children, and just like a domino effect, they'll be able to learn that from us as well.
And then lastly, improved sleep quality. So obviously when you are dealing with trauma, you're not able to fall asleep, you're not able to stay asleep, things like that. And so in this case, by handling that trauma, that quality sleep that we need to get for our physical health will be there.
Yes, correct.
Now, when it comes to EMDR, it's really important, I think, to make sure that we understand that dealing with our trauma that's the key, is just dealing with it and processing it. But the beauty of this is, again, it's not talk therapy. You're not talking through it, having to relive it all. You're handling it and I want to see some of these tools and how they work. I feel like it's so interesting. So if you wouldn't mind showing us.
Of course, yes. Let's.
It's a show and tell. We rarely get some show and tell, but I think this is great for people to really understand it. And I know I'm very curious about the light behind you specifically, with how that would work if you are helping somebody through trauma with that.
So instead of utilizing, let me turn it on.
She has an app for it and everything.
Oh yes, now everything just works with apps and technology. All right.
So I noticed like there's like a blue light and a green light that I've seen so far, and there's the yellowish light.
Yes. So, and if you could
Okay.
So one.
Okay.
So this will be in the installation phase where, okay, you're ready to process, you already have all of your coping skills. I'll ask you, okay, Tom, you know, we have a safe word, right? If you want to stop, we'll stop. Let's go back to that traumatic event. Okay. How distressing does it feel? And you'll be able to tell me, well, you know, I'll give you like from a number from 1 to 10. Well, it feels 10, like I'm really mad when I recall this event. Okay, Tom, where does it feel in your body? We talked about body sensations, how we scan. It feels in my chest. Okay, Tom, stay with that. And then I'll have you look at the light, and then we'll do with the tactile as well.
All right. And you're just basically following the light?
And follow the light. Yes.
And these are vibrating in my hand at the moment. So you're feeling the vibration of that while you're doing that?
Yes, and they're actually synced. So as this one goes to the left or the right, so will those. And it can, so if you're having different, let's say, oh, you're having difficulty concentrating, it'll change lights kind of to have like that mild disturbance and just take you back to that memory in case you kind of like lost that concentration there.
And then the headphones, what would they do? Is it just to block out noise?
No, the headphones actually yes. So it's synced as well. So if the light goes to the right, the tapper goes to the right, and so will the noise on your right ear, and it takes turns. So you'll definitely be very much integrated into the bilateral stimulation. So it'll be visual, tactile, and auditory.
All right. And when it comes to this treatment, like how long are you sitting in one of these sessions? Once you start this and you're going through those memories and you're trying to, you know, desensitize it, how long would a session last?
It takes approximately, so the sessions are, again, it's not talk therapy, but the sessions do last approximately about an hour and a half.
Okay.
So from beginning to end, and because what we want to do is to eliminate or get to the smallest number so that you do not feel that intense emotion. I don't want to let you go back home and you're still very much with that emotion. So it takes about an hour and a half, and you'll be able to notice a difference.
And then you said now, obviously, if you've dealt with a severe trauma, that could be between 8 to 12 sessions that you may have to go through.
Yes, that is correct. 8 to 12 sessions, and remember, but it's all about preparing you, making sure that you're ready. If you've had many years in therapy or trauma therapy, you'll probably know a couple of coping skills that will be able to integrate that, and it'll kind of speed the process a little bit faster. But the majority of the patients do start noticing a lot of positive effects within the first session.
Now, if you had a trauma that isn't as significant, are you still able to go through EMDR therapy, like 2 or 3 sessions of it to kind of resolve it, or is this more recommended for those dealing with some more heavier trauma?
No. This can be for anyone. It could be for acute stress, even for something just a minor incident. So, ever felt you get mad and so, you know what? I'll just deal with it tomorrow. The following morning, you wake up and it doesn't feel like that emotion is so strong anymore, right? So what happens? Basically, what this one and what the visual, the tactile, and the headphones are doing, it's a simulation of REM sleep, right? Which stands for rapid eye movement, which is your 4th stage of sleep. You're in that deep sleep, and when you're in that deep sleep, what happens? Your eyes are moving just like the machine, back and forth, right and left. So that right there is your brain recovering from the daily trauma, from the events that happened daily. So even something as small or significant, it can be processed with the eye movement. So it's it's very it could be like EMD, where you know what, let's do something short, or the full EMDR with the big T for big trauma, with the little T a small trauma. It all depends what you want to process. So at the facility at South Texas Behavioral, we use it now with our patients. So they get triggered by another patient or something that was said, or they just recalled, that memory comes up. I might not know the patient completely to know it's full history, but I am able to emotionally regulate them and bring that intense emotion down just by asking them kind of, would you allow yourself to do some eye movements and help decrease that strong emotion? They'll say yes, and then we immediately do that. I'll use my hand, right? Because if it's immediately, so I'll do a couple of passes. I'll do about 10. Okay, can you rate how that intense emotion is right now from a 1 to a 10? Okay, it's a 10. I'll do a couple of them. I'll say about 15 to 20 minutes, and that patient is no longer with that anger, with wanting to just have that extreme anxiety and being emotionally dysregulated. So definitely treat something from an immediate emotion, small trauma to big trauma.
And again, it's not just PTSD. Obviously, you talked about anxiety disorders, so being able to deal with panic disorders, phobia, social anxiety, depression disorders, so major depressive disorder, persistent depressive disorder, eating disorders as well. And then there's obsessive compulsive disorder and obviously trauma that we're dealing with. So there is a lot that this can be beneficial for if you're dealing with any of those conditions. It may go a long way in helping.
Oh yeah, and especially if sometimes we don't like to talk about our traumas because you don't want to relive it, or you have that shame of, well, I don't want them to kind of judge me. This is perfect, right? Because it's very minimal talking that you do while you are processing. What the therapist will do is ask, okay, what do you see now? And you'll be able to describe it within a couple of words, because I don't really want you to get out of that tunnel. And then it's, okay, let's go with that. And you continue processing that emotion. So it's pretty neat. And basically what the therapist just says all the time is, let's go with that.
So who would make a good patient for this?
Who would make a good patient for this? Well, it's for PTSD and trauma survivors, people with anxiety, panic attacks, and those experiencing grief, loss, depression, as well as individuals with low self-esteem. More than anything is knowing if the patient is able to develop that tolerance, that coping skill. And if the patient is able to develop that coping skill and falls within that window of tolerance, then we can start little by little. So I don't immediately have to take you to that big trauma. We can start with something small and then just work our way down to the touchstone memory.
Now we do have some questions from the audience. So what qualifies you for EMDR therapy?
Oh, so what qualifies you for EMDR? So anybody experiencing any distressing symptoms. Again, we go back to grief, right? It doesn't mean that you will forget about the grief, but it will help desensitize or help that emotion just be a little less. PTSD, survivors of trauma. So it's used a lot with our veteran population. This is now one of their number one therapeutic approaches that they use, as opposed to that prolonged exposure, as well as domestic survivors, and again, people that feel stuck with that emotion and don't understand where it's coming from.
Yeah. And is this covered by insurance?
Yes, it is. Okay. Yes, it is. It's covered by insurance. Documentation is very different, but your therapist is able to follow what is the protocol. But yes, it is. It's covered by insurance. And again, I offer it for my patients and outpatient services.
Now, when you're dealing, obviously you talked about the 8 phases that you go through. Obviously you have that patient history and information taking that you're getting. About how long, is that basically one session where you're kind of sitting, going through? Because you also don't want to rehash it too much when you're not ready to treat it yet.
Yeah,
right?
It's actually shorter. It's an actually shorter version of, all right, so what brings you into therapy? My anxiety. All right, so let's go with that. What is, since when did you start experiencing this? Okay, and then we jump into beliefs. Okay, well, what does this make you believe? Okay, and and then I'll ask, okay, so now you have this belief. When is the farthest that you can remember that you had this belief? So the patient will say, oh, it's about 9 years old. All right. And then I'll just create a treatment sequence plan based on that.
Oh, wow. Just that little information
Just
you're
that
able to
little,
do a lot with.
yeah.
That's incredible. And then obviously there's that preparation and education. About how long does that take to really prepare a patient and educate them on the process, what they're going to go through?
So once for that, it'll take approximately, it all depends on the patient, right? Sometimes they don't feel secure, they're scared, they think you're gonna hypnotize me. But once they're educated, I also show them videos, and then I'll take them into the preparation stage. So that's probably like another session. And then what's the longest is the resourcing, right?
Okay.
Helping them find those coping skills, because not what works for one doesn't work for everyone. So definitely trying out different coping skills for our patients.
Mm-hmm. Now, when you talk about those coping skills, obviously those are so important, and there's so many different ways to tackle, you know, how to cope with something, to deal with something. And obviously, they always say that you should have your little self-care sensory box, right? So how you're able to do, are patients able to bring in, like, their, let's say a blanket makes them feel comfortable, they need that touch sensation or whatever. Do they bring those items into that session with you?
Yeah, so we use a lot of visualization, Tom,
Okay.
with EMDR, but sometimes our patients that have complex trauma are not able to go through that visualization. So in order for me to help them ground, I do use things like a blanket, right? What is it that makes you safe? At all times, what makes my patient safe? And they'll tell me, Letty, you know, can I bring in my blanket? Can I bring in my teddy bear just to help me ground? Perfect. So yes, they can definitely bring in anything that will help them ground, which is in a sensory way.
Mm-hmm. And then I know that you talked about the 6 phase, the body scan. How does that, what do you mean when you do a body scan?
So when you do a body scan, I ask, well, where is the emotion? How is that emotion linked to that memory? And where does it feel in your body? Mm-hmm. And the patient will tell me, you know, it feels in my hands, the anger feels in my hands, it feels in my gut, it feels in my chest, Letty, you know, and the deep breathing, the hard breathing. So that's the body scan that we do. Now, once the trauma is processed, I ask again, we do a body scan. Where does it feel now? Mm-hmm. The majority of our patients, it changes because now they feel a relief. They don't have that intense emotion. So they'll say, 8 out of 10 will say, it feels like tingly in my hands. It just feels, I feel lighter. I don't know. It just feels good. I feel calm in my chest. Mm-hmm. So.
And then you get to that final phase, the reevaluation and continuing care. So after you go through EMDR therapy, what is the prescription for follow-up care? Is there any necessary per se, or it's just obviously depending on the need of the patient?
It depends on the need of the patient. So if they find something for them to be distressing, they can always come back, or something maybe that wasn't uncovered. And a lot of times, because there's new neural pathways that are installed with EMDR, they'll start having more dreams, and that will uncover more things to process. But they will already be equipped with healthy coping skills that they can always go back and utilize. Mm-hmm. So then I'll just probably see them like once a month, just for that continued mental health checkup.
Yes, just to check on them, mm-hmm. check on their status, make sure they're great.
There's no recurring bad dreams or anything in that regard.
Mm-hmm. This is all so truly amazing. It's so interesting, and I can see why you picked up on it, because I as a clinician, I know you love the patients that you work with and helping them through, and, yes. And this is just a great tool that you have in your arsenal to help people cope with their traumas.
Definitely. It's new, it's backed by neuroscience, and it's something that's out here for the community and for our South Texas health system community.
Yeah. So if someone is interested, what do they have to do to find out more?
You can contact me at South Texas Health Behavioral, Director for Outpatient Services. We'll do an evaluation and we'll integrate you into our group, our team, and we'll start with the education process of EMDR and see if you're a right fit for it.
Yeah, this is all incredible, and thank you so much for your time and for the education, Tom, on this new therapy that seems to be doing wonders for a lot of people.
Thank you, Tom.
All right, thank you, Letty. And that officially concludes our webinar. We thank you for watching. We hope you'll continue to prioritize your mental health and the mental health of your loved ones. Now, if you are experiencing mental health challenges, SDHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 956-388-1300. Please remember that you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Line at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, March 6th at 5:30 p.m. live via Facebook when we'll discuss bipolar disorder. We hope you can join us. And to watch our previous Let's Talk Mental Health webinars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please continue to prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.